Introduction. Good day everyone and welcome to today's lecture. Our focus will be on adjustment disorder with depressed mood, a condition commonly encountered in clinical practice, but often misunderstood or overlooked. It sits at the intersection between normal stress reactions and more serious psychiatric disorders, like major depressive disorder. Definition and diagnostic criteria. Adjustment disorder is classified under trauma and stressor-related disorders in the DSM-5-TR. It refers to an emotional or behavioral response to an identifiable stressor occurring within 3 months of the onset of that stressor. An adjustment disorder with depressed mood is a subtype where the predominant symptoms are low mood, tearfulness, feelings of hopelessness. Key DSM-5-TR criteria. Symptoms arise in response to a stressor, e.g., divorce, job loss, illness. Reaction is out of proportion to the severity or intensity of the stressor. Significant impairment in social, occupational, or academic functioning. Symptoms do not represent normal bereavement. Duration is less than 6 months after the stressor ends, unless the stressor or its consequences persist. Causes and common stresses. Adjustment disorders can be triggered by any significant life change or challenge. Common examples include breakup or divorce, job loss or career change, serious medical diagnosis, moving to a new location, family conflict, retirement or empty nest syndrome. These events can overwhelm a person's usual coping strategies, especially if there are limited social supports or prior mental health issues. Differential diagnosis. It's important to distinguish this disorder from major depressive disorder, MDD, more severe, persistent symptoms, not necessarily triggered by a specific event. Grief bereavement, normal process and less complicated or prolonged. Acute stress disorder, PTSD, involves trauma, not just stress. In adjustment disorder, symptoms are milder and clearly linked to a specific stressor. Psychological features. Clients may present with sadness or depressed mood, anxiety or worry, decreased motivation, poor concentration, sleep difficulties, withdrawal from activities or relationships. These symptoms are typically transient and may resolve on their own, but can also escalate if untreated. Treatment approaches. Most individuals with adjustment disorder respond well to short-term intervention. A. Psychotherapy, first-line treatment. Cognitive behavioral therapy, CBT, helps reframe negative thoughts, develop coping strategies. Supportive counseling offers emotional support and validation. Problem-solving therapy teaches practical skills for managing stresses. Mindfulness and stress management techniques. B. Pharmacotherapy, often not necessary unless symptoms are severe. Short-term use of antidepressants or anxiolytics may be considered in some cases. C. Lifestyle support, encouraging social support, physical activity, sleep hygiene, time management skills. 6. Prognosis. Adjustment disorders are typically self-limiting, especially with treatment. Most people recover within 6 months of the stressor ending. However, if untreated, it can evolve into major depressive disorder or generalized anxiety disorder. Case example, optional for teaching. Case: a 22-year-old university student reports feeling overwhelmed, sad, and unmotivated after failing 2 midterms. She has withdrawn from friends and stopped attending classes. Symptoms began within a few weeks of the failure and have lasted for 2 months. No previous mental health history. Assessment: no suicidal ideation, no past depression, clear link to academic stressor. Diagnosis: adjustment disorder with depressed mood. Conclusion: adjustment disorder with depressed mood is a common situational and treatable condition. It highlights how individuals react differently to life changes and why early support and intervention can prevent worsening mental health.